Hi guys, welcome to our gross anatomy lecture. Today we're going to talk about the forearm. Most importantly, the anterior compartment of the forearm. Right, the forearm is actually divided into two, um, but some they divide it into three, some texts, but most commonly it is divided into two. You're going to have an anterior portion, which is called your flexor compartment. We say that muscles of the anterior portion of the upper arm, they are flexors. Posterior portion of the upper limb, they are what? They are extensors. So definitely the anterior is going to be a flexor compartment, the posterior, the extensor compartment. Right, so let's take a look what divides these compartments. Right, if I take a zoom like this is actually a cross section of your forearm. This medially you have your ulnar, laterally you're going to have your radius. Between the ulna and the radius, we have important membrane called the interosseous membrane, right? And then remember, if we reflex the skin, you're going to have the superficial fascia. From the superficial fascia, you're actually going to have what called the antebrachial fascia, which is the deep fascia. So the deep fascia of the forearm will send what you call intermuscular septa, right? So that will actually attach. So you're going to have this intermuscular septa, right, and another intermuscular septa, which will attach the anterior border of the radius, and another intermuscular septa, which will attach the posterior border of the radius, which is not shown here. If you are going to divide the forearm into three compartments, right? So, but as of here, we have an anterior intermuscular septum attaching to the anterior border of the radius. So therefore, we divide the forearm into anterior compartment and posterior compartment. So the anterior compartment is for flexor muscles, and then the posterior compartment is for extensor muscles. So let's take a look at the blood supply, the muscles, the nerves, as well as a bit of some lymphatics of the anterior compartment of the forearm. Right, let me zoom out so that we can actually see the anterior compartment. So right here, you can actually appreciate that this was your cubital fossa, which we spoke of into our in the video for the cubital fossa anatomy. So from the cubital fossa, you're going to have this antebrachial, which is your forearm, right? So anteriorly, you're going to have muscles, important muscles, right? And some of these muscles, they actually form the boundaries and the floor of your cubital fossa. So you're actually going to be familiar with some of these muscles. The muscles of the anterior forearm, they are divided into three. There is an anterior, the superficial group, the intermediate group, and the deep group. So I'll start with the superficial group. So the superficial group is actually exciting because you use a mnemonic. So the superficial group, you use a mnemonic P, F, P, F, P, F, P, F. You understand? So you're actually going to have the first P, that's your pronator teres. The F is going to be your flexor carpi radialis. The P is going to be for your palmaris longus, and the other F is going to be for your flexor carpi ulnaris. All these muscles, they originate from the medial epicondyle, right? That's where you have your flexor origin. This is your common flexor origin, right? So all these muscles, they are actually going to originate from the common flexor origin. That's your medial epicondyle, right? So let's take a look at one of these muscles, right? And just take a look at their origin and their insertion. Right, so let's take a look first at the pronator teres. So from the word pronator, its action is pronation, right? And since it is in the anterior compartment, which is the flexor compartment, it also flexes the forearm. So that's the action. So it actually has two heads, which are very important when it comes to the course of the median nerve, because actually the median nerve, it leaves the cubital fossa right here via the two heads of the pronator teres, which is actually cut here, right? So you're going to have another head, which is a humeral head, and another head, which is an ulnar head, right? So the humeral head and the ulnar head, they actually join, and then they will insert on the lateral aspect of the shaft of the radius, which is where you find the pronator tubercle. So this muscle is very important because it forms the medial border of the cubital fossa, and it's also a pronator of the forearm, right? And then apart from that, we are actually going to have another muscle called the flexor carpi radialis, originated from the common flexor origin, that's your medial epicondyle, and it actually inserts at the base of the second and third metacarpal bones, right? It has two actions. It has two actions. First of all, we have flexion, right? Facilitated flexion of the forearm, flexion, right? And it also abducts because it attaches here. So when it contracts, it can also abducts the hand, right? When it contracts, it also abducts the hand. After that, you're going to have your palmaris longus. Your palmaris longus also originates from the common flexor origin, that's the medial epicondyle, and then it actually inserts on the flexor retinaculum. There's a video for the flexor retinaculum and the palmar aponeurosis, right? So its main action is to flex the hand, and taking note of this muscle can actually be absent in 10% of population. The palmaris longus can actually be absent in 10% of population. And then from that, we are going to have your flexor carpi radialis. Your flexor carpi radialis, it also has two heads, which are also important for the course of the ulnar nerve, because the ulnar nerve, it actually passes between the two ears of the flexor carpi ulnaris as it enters the forearm. Very important point over there. Right, so you're going to have definitely the humeral head from the medial epicondyle, and then you're going to have the ulnar head, which will come from the olecranon behind, from the olecranon process of the ulnar. These two hairs, they will form a belly of muscle. This one, that's your flexor carpi ulnaris, and this will actually insert on the following. It will insert on the base of the it forms. All right, it actually inserts on the base of the fifth metacarpal and inserts on the hook of Hammett and the pisiform bone. So it's very important to understand that the pisiform bone is actually a sesamoid bone that is formed within the tendon of the flexor carpi ulnaris. A very clinical, a very important MCQ question. That the pisiform bone right here, you can actually see is found within the tendon of the flexor carpi ulnaris. So therefore, it is a sesamoid bone. You understand? So what's the action of the flexor carpi ulnaris? Well, the flexor carpi ulnaris, it's definitely for flexion, and it also adducts the wrist joint. Adducts the wrist joint. So let's take a look at the nerve supply of all these muscles in the superficial portion of the forearm. So the pronator teres, the flexor carpi radialis, the palmaris longus, they are all innervated by the median nerve, except for the flexor carpi ulnaris. It's innervated by the ulnar nerve. So the ulnaris innervated by the ulnar nerve. You understand? So just for your sake, you have to understand that most of the muscles of the anterior compartment, they are all innervated by the median nerve, right? Except for two, One, the flexor carpi ulnaris and the medial portion of the flexor digitorum profundus, as we're going to see. So we are done with the superficial group of muscles. Let's take a look at the intermediate group. So in the intermediate portion, we only have the flexor digitorum superficialis muscle. So let's take a look at the flexor digitorum superficialis muscle. Right, so right here, that's your flexor digitorum superficialis, which is found in the intermediate compartment of the forearm. It also has two heads, right? It has a humeral ulnar head, which a portion comes from the humerus, medial epicondyle, and some part from the ulna, right? And then it actually also has a radial head, right, which attaches the oblique line. Remember the oblique line, the shaft of the radius? Yes, that's where you have the attachment of the radial head of your flexor carpi, of your flexor digitorum superficialis. Your flexor digitorum superficialis will actually insert on the medial phalanx, right? Medial phalanx of the medial 4 digits. So you can actually see it actually attaches, and it forms sort of like, it divides itself and attaches to the medial phalanx like this. Attaches to the medial phalanx. And this one that you see, that will pass between these two limbs of the flexor digitorum superficialis, is actually your flexor digitorum profundus that we are about to talk about. So your flexor digitorum superficialis, its action is for flexion. Flexion, right. Innervation, median. Let's take a look at the flexor digitorum profundus. So in the deep group now of muscles, you're going to have your flexor digitorum profundus, right? You're going to have your flexor pollicis longus, right? You are going to have your pronator quadratus muscle, right? So let's take a look at the flexor digitorum profundus. So the flexor digitorum profundus muscle, it originates from the anteromedial surface of the ulna, right? Its most portion origin is from the ulna, and then it actually inserts in the distal phalanx of the medial 4 digits. This one, this one, this one, this one. And its main action is actually for flexion. So it flexes the distal phalanx of the fingers, right? And it actually assists in the flexion of the middle and the proximal phalanx as well, and the wrist joint. So it flexes the wrist joint. Remember, a muscle is on the joint that it crosses the wrist joint, it flexes the wrist joint, it, it, uh, it, it crosses also this joint, it flexes this joint, it flexes this joint, right? So it flexes this joint and the wrist joint. What is important about the flexor digitorum profundus is that it is innervated, it is dual innervation. The lateral portion is actually innervated by the median nerve, whereas the medial portion is innervated by the ulnar nerve, which is actually very important. And then you're going to have your pronator quadratus, which originates from the anterior shaft of the ulna and it sits on the anterior shaft of the radius. Its action is for pronation again, innervated by the median nerve. And then you're going to have your flexor pollicis longus. Whenever you see the pollicis, it means it's going to the thumb. So it actually sits on the distal portion of your thumb, which is important for the flexion of the thumb. This muscle is innervated by the median nerve. Good. It also flexes the wrist joint because it crosses the wrist joint. So these are important muscles of the anterior compartment of the forearm. Let's take a look at the blood supply of the forearm. Right, so it's actually very fascinating, the blood supply of the forearm. Let me actually zoom a little bit so that we can actually get into it. So as for today, there is a separate video for the elbow anastomosis, which I spoke of. You can check that video. Right. So There are two main arteries that supplies your anterior compartment. You have what called the radial artery and the ulnar artery. So at the level of the neck of the radius, you're going to have a bifurcation of the brachial artery that is actually within the cubital fossa. Right. So you're going to have the ulnar artery, which is the largest, of the branches that are given by the brachial artery. The ulnar artery, this one, it's actually very important because some of its branches are actually going to take part in the elbow anastomosis. So it's going to give the first branch, which is called your common interosseous artery, right here. So the common interosseous artery will actually give three branches, right? It's going to give an anterior interosseous artery, which will be running uh, on the interosseous membrane, right? And supplying muscles of the anterior compartment. And then you're going to have your posterior interosseous artery, right? You can actually see, which is a branch of the common interosseous artery from the ulna, right? So this posterior and the anterior interosseous artery, they actually communicate. So you can actually see some branches of the posterior interosseous artery supplying the anterior compartment and branches of the anterior interosseous artery supplying the posterior compartment. You understand? Right. So it also gives a recurrent interosseous artery which will actually take part in the anastomosis of the elbow joint. So the ulnar artery will actually descend down, right? So it will actually be lying undercover the 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 flexor carpi ulnaris muscle and sitting on the flexor digitorum profundus. You can actually see. So it starts at the upper portion of the forearm. It will be a bit deep, but as it comes distally, it's actually going to be superficial, right? And then it will be superficial to the flexor retinaculum and lateral to the ulnar nerve. You can actually see it will be lateral to the ulnar nerve and lateral to the pisiform bone, right? And then it's actually going to form the superficial palmar arc. So the superficial palmar arc is formed by the ulnar artery. Let's take a look at the radial artery. So the radial artery is also a branch of the brachial artery at the level of the radial neck, right? It actually descends at the undercover, the brachioradialis muscle. You remember you have the brachioradialis muscle, right? So it will be sitting, it will be moving at the undercover, the brachioradialis muscle, right? And then at the mid portion of the arm, you're actually going to see the superficial branch of the radial nerve being lateral to the radial artery, right? So the radial artery at the distal portion of the forearm, it's actually going to leave going to the posterior portion of the arm, being a content of the anatomical snuff box. Remember, we can actually feel some pulsation in the anatomical snuff box of the radial artery because it will actually turns and goes into the dorsum of the hand. In the dorsum of the hand, it's actually going to continue as the deep palmar arc. So the superficial palmar arc is from the ulna, the deep palmar arc is for the radial artery. It's actually very important that we actually have pulsation sites, 3 pulsation sites here. One, the pulsation site of the ulnar artery right here, just medial to your flexor carpi ulnaris. And then you have your second pulsation site of the radial artery right here, just medial to the brachioradialis and your flexor carpi radialis muscles right here. That's your second. And then your third is going to be in the anatomical snuff box. That's another pulsation site, right? So that's going to be your blood supply of the forearm. Let's take a look at the nerve innervation of the muscles of the forearm. So there are 2 important nerves First of all, you're going to have your ulnar nerve. Remember, your ulnar nerve piercing the medial intermuscular septa of the arm, going to the posterior compartment, goes behind the medial epicondyle, right? It leaves the medial epicondyle between the two heads of the flexor carpi ulnaris, right? And then it runs medially at the undercover of or sandwiched between the flexor carpi ulnaris and the flexor digitorum profundus. So that's why we say the medial portion of the flexor digitorum profundus is actually innervated by the ulnar nerve. The ulnar nerve is actually going to be superficial to the flexor retinaculum right here, and it's going to be medial to the ulnar artery, but lateral to the pisiform bone, right? Then let's take a look at the median nerve. The median nerve, which is actually going to be medial to your brachial artery, as you can see right here. It actually leaves the cubital fossa between the two ears of the pronator teres, right? And then it runs between the superficial, um, it runs between the flexor carpi, the flexor digitorum superficialis and flexor digitorum profundus, right? Take note of this. The median nerve, it supplies most of the muscles in the forearm, except for the medial portion, the flexor digitorum profundus and the flexor carpi ulnaris. The median nerve, it actually gets gets into the hand by passing behind the flexor retinaculum, right, between the fibers of the flexor digitorum superficialis and the flexor carpi radialis, right? It actually passes through a limited space, and due to this limited space, if there is actually edema um, or swelling of the synovial membrane, you're actually going to have what you call carpal tunnel syndrome, as you're gonna see, right? So that's gonna be the cause of the median nerve. So thank you so much, guys, for taking your time to listen to this video of the anterior portion of the forearm. Thank you so much. See you next time and take care.